Hi everybody, welcome to my YouTube channel Dr. Sreenivas Medical Concepts and my FB page Dr. Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh, India. I am also the medical author of the books Focused Neurology and Exam Oriented Clinical Neurology. My email is sreeklpm@gmail.com. We are continuing with the Neuro Imaging Concepts series. So today we are going to discuss the magnetic resonance spectroscopy, otherwise known as MRS. Neuro Imaging Concepts Part 7, Magnetic Resonance Spectroscopy. Magnetic resonance spectroscopy, MRS. The tissue concentrations of a variety of cellular metabolites can be determined with the technique of MRS. So, for example, glioma tumors or other pathology, it produces various metabolites which can be detected by this sequence magnetic resonance spectroscopy or MRS. So the tissue concentrations of variety of cellular metabolites can be determined with the technique of MRS, magnetic resonance spectroscopy. So what are these substances? What are these chemicals which can be metabolites which can be detected? Among these substances, N-acetyl aspartate, NAA, is a marker of neuronal integrity and is decreased in both destructive lesions and in circumstances in which there is a reduction in the density of neurons like edema or glioma that increases the distance between the tumors. So among these various substances, N-acetyl aspartate, NAA, is a marker of neuronal integrity and is decreased in both destructive lesions and in circumstances in which there is a reduction in the density of neurons like edema or glioma that increases the distance between the tumors. The other substance is the choline, otherwise known as CHO. Choline is a marker of membrane turnover and is elevated in some rapidly dividing tumors. So if you want to find out whether they are rapidly dividing tumors, when we use MRS, magnetic resonance spectroscopy, we would find an elevation of choline. So choline is a marker of membrane turnover which is elevated in some rapidly dividing tumors. Compared to the normal white matter, the spectrogram of a glioma characteristically shows decreased NAA and increased choline concentrations. So in glioma, when we do MRS, there is a decreased NAA and increased choline concentrations. It is also possible to measure a number of other metabolites such as myoinositol, creatine and lactate. So when we see the imaging, we can understand it better. So MRS spectroscopy, visualization of the biochemical and molecular composition of a specific tissue or tumor. So these are all the various metabolites which get elevated. So we can see whether it is increased or decreased. So whether it is increased or decreased, and then we can find out what is that particular tissue by the amount of the substance or the which is either increased or decreased. So this is MRS. The other important concepts of clinical neurology, especially exam oriented, I have put it in a book called Exam Oriented Clinical Neurology, written by me, Dr. Sreenivas, which will be very useful for students appearing for clinical neurology exams. If interested, this book could be purchased. The other important concepts of neurology, I put it in a book called Focused Neurology in a question and answer format, written by me, Dr. Sreenivas. This book is available online from all leading booksellers including Amazon. So if interested, this book could be purchased online. I hope you have enjoyed listening to this wonderful topic of MRS. If you have enjoyed it, please like it and share the link. But please subscribe my YouTube channel, Dr. Sreenivas Medical Concept, which is India's leading neurology educational YouTube channel, and my FB page, Dr. Sreenivas Concepts. Thank you. Bye.